get started. Thanks so much for joining me this morning, afternoon, whatever time it is for you. I'm in Texas, here in Austin, so it's around noon for us. So I'm Dr. Krista Jenny. I'm a women's health physical therapist, and today we're going to go over some common postpartum challenges and then go over some exercises for postpartum recovery. So first we'll just start with some common, but maybe not normal, things that some moms experience. So number one, diastasis recti. So that's the separation of the six-pack abdominals. Now it is pretty normal for people to have a little bit, like a 2-finger gap. When it starts to get over 3 fingers is when we're more concerned. But yeah, that's that separation of those six-pack ab muscles. First week postpartum, most people have a little bit of a separation, but that should start to gradually close. If you're noticing that you still feel that gap or that it's still opening, that's when reaching out to a women's health physical therapist can be really helpful. A lot of times there's a lot of tight fascia on the sides of our abdomen that needs to be released. If you think like your whole body's a cable knit leotard, if we have this fascia pulling apart at your six-pack abs, it can pull them open. So getting all these muscles nice and loose and mobile can help train those muscles to come back together, and then working on the deep core strength. So our linea alba is the connective tissue between those six-pack abs, and that can get stretched apart. And so that's when that fascia release can be really helpful, but then also there's the depth. So them coming apart is the width. We actually care more about how deep the diastasis is. So some people have such weak, deep cores that you can actually push your fingers all the way back and reach towards their spine. So the transverse abdominis is that muscle that's kind of like a corset that holds everything nice and strong. If you think like you stop the flow of urine, you should feel a slight draw in of your deep core. So pelvic floor muscles are all in red. A lot of people don't know we have muscles down here, right? So when these muscles fire, some cues are like stopping the flow of urine or holding in gas, drawing a marble up and in, relaxing, dropping it down and out. When we engage these muscles, our deep core, transverse abdominis, that's right near your pubic bone. If you were to touch your abdomen about right here, when you do that, stop the flow of urine or do what you think is your Kegel, you should feel a slight draw in. It's not a super strong contraction. I like to think a little zipper from your pubic bone and belly button zippering up, like 20% effort, draw up and in. So that's your kind of brace or deep core engagement that we need to have to help prevent that depth of the diastasis. So that's when a lot of exercises for the deep core can help decrease that depth. So those are some things for diastasis. Another common thing is pelvic organ prolapse. So this could be any of the organs, the bladder, the uterus, the rectum. There's other types of prolapse too, but the organs start to descend down into the vaginal canal. Now it is pretty common to have a diastasis postpartum. Over 50% of women typically do have a slight prolapse postpartum if they did give birth vaginally. But most people can be asymptomatic, so you can have a grade 1 or grade 2 prolapse and become symptom-free by working on your deep core strength, your pelvic floor strength, working on pressure management techniques and posture can really help improve symptoms of prolapse that you might still have a small grade prolapse, but you can live symptom-free without even knowing you have one. So that's really good to know, and that you're not alone and that it is very common postpartum. For both diastasis and pelvic organ prolapse, there are postpartum belly bands or postpartum support garments that are kind of like little briefs that you can wear. With the postpartum belly bands, I always recommend wearing them low. So they're all the way down at the pubic bone, so your pubic bone's way down here. So if you were to have your band, you would want the bottom to come all the way down low. You're gonna have it a little bit tighter at the bottom and looser at top, because you don't want the band to be compressing down and pushing your organs down. Another thing you can do if you are wearing the postpartum band is to bring your hands under the band, pull your belly up and in to help approximate those muscles before you secure it in place. And again, it's tighter at the bottom, a little bit looser at top, just so that we're helping lift up towards your head instead of pushing down towards your pelvic organs. The briefs can be really, really great too. Some of them have like a little support hammock on the underneath that can help provide just a little lift and compression to the pelvic floor to make it feel like there's less pressure pushing down. And with any kind of band or support garment, just making sure it's never causing any what I call the 3 Ps, pain, pressure, or peeing your pants. If any of those symptoms are worsening from wearing any type of support, make sure you're taking it off. And again, these support garments are kind of a crutch until you can build that deep core strength. So making sure you're still using your deep core pelvic floor and that you're not relying on any kind of support to do all of the work for you. Next, we'll move on to urine, bowel, and gas incontinence. So postpartum, it is pretty common to have more gas the first 3 to 4 months postpartum, but it's not normal if you can't control that gas. So always reach out to a pelvic health provider if you're leaking urine, gas, or stool without trying to, or without being able to control it. So like with gas, it's normal to have like 10 to 20 farts a day. Just that's a sign of a healthy gut, but if you're not able to control it, that's when we're starting to get concerned. Also, a lot of moms are having C-section scars. That's a major abdominal surgery, and a lot of times we lose the innervation to our deep core muscles and have to retrain our core and pelvic floor. And even if you had a C-section, your pelvic floor was still affected for the entire duration of pregnancy. So pelvic PT is still really important if you had a C-section. And with any type of scar tissue, whether it be a C-section scar, or if you had perineal tearing and have tearing from the vaginal canal or opening down towards the anus, we want to make sure we're mobilizing that scar, but making sure you're getting approval from your OB or physician first. We always want to make sure the scar's fully healed before we start really moving it around a lot. Typically, we can start some gentle scar work around 6 weeks and then can get more aggressive with it around 12 weeks. But just like you can lift your skin up anywhere else on your body, you want to be able to lift your scar and move it around as well. Shouldn't be painful. A lot of times with restricted C-section scars, it can contribute to other pelvic floor issues like difficulty emptying the bladder, or pain with urinating, or pain with bowel movements, or even constipation, just because the restrictions can make it hard for everything to flow. Also with the C-section or perineal scar, we can work on desensitization exercises, so just becoming more confident touching around the area. So maybe with the C-section scar, you're starting with just a cotton ball and it's super soft, just bringing it around, maybe not even over the scar, above and below it, just to help desensitize that area. Can move to more of a soft Velcro-like consistency or a towel and go over that area, and then could go more to like the rough side of Velcro, just so that you're getting more sensations and being able to tolerate more pressures and sensations as well. With the belly bands and support garments, those can be great for C-section too, to apply some pressure and support, especially with activities like coughing, laughing, sneezing, having a bowel movement. When you do have that scar from the C-section, it can be helpful to have some pressure, or maybe even holding a pillow over your incision before you do those activities with high abdominal pressure, just so you don't feel that pressure going out towards the front. And with the perineal scar, sometimes using a vibrating vibrator that vibrates can help desensitize the area as well. And then a lot of people do have painful intercourse postpartum. Sometimes this can be from the restricted scar tissue, so it might feel like you're hitting a wall with intercourse. That's when the perineal scar mobilization can be really helpful. But postpartum, our estrogen levels do plummet, so that can contribute to vaginal dryness, which can cause discomfort from intercourse as well. So I always like to say you can never use enough lube postpartum. But if you're still having pain with intercourse, even if you're using a lot of lube, that's when I would reach out to a pelvic PT, because we can really help with that as well. If you feel like it's more of a confidence thing with going back to intercourse, that's when vaginal dilators can be really helpful. So these are medical grade and they come in all sizes, super tiny to about the size of your partner. So that's a way you can just gain confidence before going back to intimacy as well. Another common complaint is pelvic girdle pain. So whether that be at the pubic symphysis here, these joints can kind of slide and glide and cause discomfort, or at the SI joint. These with the ligament laxity postpartum can be affected, as well as just low back pain. So later on when we go over the exercises, I'll go over some fascial sling exercises that can help with that instability. So the SI joint here, there aren't really any major muscles that pass through here. The glutes are more on the outsides, they don't really cross, but we do have thoracolumbar fascia that does cross over these SI joints. So we'll go over some exercises that you can help build those sling systems to help have some more compression in these joints and feel more stable. There are also things like SI joint belts that can be helpful as well, that you wear low and just provide some compression. Typically up to around 6 months postpartum, if you're still breastfeeding, or 6 months after you stop breastfeeding, you can have more ligament laxity just because of the hormone changes. So just to be aware of that. So making sure with activities like yoga or overstretching or weightlifting, just making sure that you're doing your pelvic brace. So I like to say the pelvic brace is like your pelvic floor contraction, and you're zippering from your pubic bone up to your belly button before you're lifting anything heavy, so that you have that nice stable pelvis. Now, majority of people, I find, don't necessarily know how to do a Kegel correctly, so that's when I always recommend, after you have your OB or midwife check at 6 weeks, you can go to a pelvic PT just to make sure you know that you're doing your pelvic floor contraction correctly. Like with that Kegel, like I said before, we want to imagine like we have a marble in the vagina, we're closing around the marble, and then we're pulling up towards our head, and then as we relax, we drop all the way down and out. A lot of people can get stuck engaged and have trouble relaxing, and tight muscles can cause pain, especially with intimacy if you're trying to penetrate and those muscles just won't lengthen. Dilators can help with that as well, but even if it's just going to a pelvic PT once to know if you're engaging correctly, to know if you're relaxing correctly, just so that you can do your pelvic brace correctly throughout the day, every day you're doing it. Let's see, what else? And then last thing I want to mention is breast changes. So with exercise, it's always great to time your workouts when your breasts are less full. Making sure you're staying hydrated. During lactation, you really need to be drinking a lot of water. So without lactation, we typically want to drink half of our body weight in pounds, in ounces per day. And with lactation, we want to include an extra 35 ounces per day. So that's a lot of water. It's good to sip your water slowly throughout the day. Sometimes if we hyperhydrate and chug a whole bunch of water at once, then it kind of just passes through us. And we want to have that slow consistency so that our body can actually absorb the water that we're intaking. Setting up a breastfeeding station, have your water, have a smoothie. Smoothies are great because they have a lot of hydration and can help you get in some extra calories. So yeah, that's super helpful. And yeah, just sometimes with skipped feedings, you can develop clogged ducts or discomfort in the breasts. So trying to time your feedings. And I know there's some controversy about bra type, but I do think you don't want to wear a super tight sports bra that's going to compress and press your boobs out to the sides, but you do want your breasts to be supported. So having a nice bra that offers 360 support to help with that lymphatic flow, prevent swelling and engorgement. So that's with that. But does anyone have any questions they want to ask about any of that before we go on to some of the exercises? Let's see. I'm just going to go here real quick. And feel free to comment right now if there's any questions you have or anything else you wanted me to add to that. There's a lot of comments, let's see. And if you haven't got out your yoga mat yet, you can go ahead and grab one. If you have a yoga block, that'll be helpful too, or just a water bottle works as well. So it sounds like a lot of moms are C-section moms. So I'm glad we went over that. If you have any more questions about C-section recovery, feel free to comment and I'll look over those. Yeah, the scar tissue is big. I know a lot of OBs don't teach about scar tissue mobilization, which is super important. Yeah, some people say it makes me sick when I touch mine. That's when those desensitization exercises can be really helpful. So someone says, why is it harder to lose weight when breastfeeding? I mean, our body's trying to hold on to weight to feed our babies. So, I mean, some people say that they lose their weight once they stop breastfeeding. Some people don't. I mean, a lot of people say, oh, you breastfeed to help you lose weight, which is not always necessarily true. I mean, everyone's so individualized, and some people, the weight won't come off until after they stop breastfeeding as well. Let's see. All right, well, we will go ahead and get started. I don't see any other questions. So this So like I said before about the increased relaxin hormones can contribute to that ligament laxity in the pelvis. So some of these exercises are going to be going over those sling systems that can help compress the joints together and kind of make the muscles stabilize the joints a little bit better. So this first one, we're going to come onto our back. This is going to be the posterior oblique sling system. So this sling system, back a little bit so you can see me, is going to be the opposite lat and glute. So our lat is our muscle that pushes our elbow down into the floor, and our glutes are our muscles that extend our hips up towards the ceiling. So it's the opposite lat and glute, but we can do both at the same time. So push both your elbows down into the floor, and then lift both your hips up. We're trying not to arch our back. We're trying to keep our spine pretty neutral, and we're trying to roll up one vertebrae at a time. So first you think about just a slight tuck of the tailbone, and then pressing your elbows down, slowly rolling up one vertebrae at a time. Head is heavy, neck should be loose. And then reverse, coming down. One vertebrae at a time, tailbone is last to drop. If this feels a little bit easy for you, you could do just one leg. So I'll use my left leg, right leg can come up to the ceiling. We're working the opposite glute and lat. So my right elbow is gonna push down into the floor, and my left glute is gonna come up and lower. Sometimes it helps to lift arm up, push down, and lift. So we're working that sling from the back to the posterior oblique. It's going from the glute across the lumbar fascia all the way to the lat to help support the SI joint in the back. So lift right arm, down, lift, and we're still trying to go one vertebrae at a time here. So first the tailbone, one spine segment at a time, and then one spine segment at a time on the other way down. And I'll switch out my legs here. So again, opposites. So now we're working our right glute, so we're going to work our left lat. So left elbow pushes down into the floor. First tailbone lifts, one vertebrae at a time up, one vertebrae at a time down. Now I like to inhale to prepare, exhale as you slowly lift up. And the reason it's great to coordinate your breath with this, you guys can keep going. I just want to explain the breath for a second. As we inhale, we blow up like a balloon. Our ribs expand, our belly expands, our back expands, and our pelvic floor descends. So as you inhale, you might feel your anus kind of dropping down towards the floor. And as we exhale, our pelvic floor and core naturally engage a little bit on their own. So try to see if you can sense that. Even if you stop doing the bridge for a second, you're just laying on your back. Inhale, feel your belly expand, feel your ribs expand, feel your pelvic floor drop. As you exhale, everything kind of comes back towards midline, and then you can try the exercise again with that. So inhale, prepare. Exhale, pelvic floor and core turn on, and all the way back down. And maybe you try that with one leg at a time. Inhale, prepare. Exhale, pelvic floor and core turn on as you lift, and slowly lower. And then we'll go on the other side. Inhale, prepare. Exhale, pelvic floor and core turn on as you lift, and slowly come down. And postpartum or pregnancy, we always want to make sure we're log rolling to get up, engage your core before you press back up to sit. And before we go on to the next exercise, let's try that breathing in sitting. So go ahead and bring your hands to the outsides of your rib cage. I want you to imagine on the inhale, you're pressing your ribs out into your hands. Exhale, don't do anything special, just let your ribs drop. Inhale, press out into your hands. Exhale, drop. So belly should come forward, ribs should come backwards, and chest should stay steady. This next one, we're gonna come onto our hands and our knees. Before we start, let's go with that breathing again. So this time I want you to think about breathing in through your back. So that diaphragmatic breathing is 360 breathing. Belly's coming forward, ribs are coming sideways, and back is lifting, pelvic floor is relaxing on the inhale. So as you inhale, everything expands. As you exhale, everything comes back to center. And you can even try to coordinate this with your back. So as you round your back, inhale between your shoulder blades, you might feel a nice stretch. Exhale, come back to neutral shoulder blades. So you're inhaling, pushing your shoulder blades up towards the ceiling. Inhaling into your back and belly. Exhale, everything comes back to neutral. Let's go just 3 more like that. So inhale, you're spreading your shoulder blades. Breathing into your back. Exhale, squeeze. scapular push-up. We're bringing our shoulder blades far apart. We're pressing our spine up towards the ceiling. So it's different than a cat-cow. It's just the scapula, working that breathing through the back. Inhale, expand. Exhale, come back down. One more time. Inhale into your back. And come back neutral. If you need to take a little break, you can sit back on your heels. So that was just kind of to warm up our breathing before we start this next exercise, which is going to be a bird dog. So this is where we're working the longitudinal or deep sling system that works our erector spinae down our back here and helps support our pelvic joints as well. So we'll come back on our hands and knees. Now, wrist discomfort can be common during pregnancy and postpartum, so you can always come onto your fists or onto your forearms. I'll come onto my fists for this one. So you can check yourself in the mirror or camera if you have anything nearby. We want our hands to be right under our shoulders and our knees to be right over our hips. And we're trying not to dump through our backs. We're finding that neutral spine. If you have your yoga block, you can go ahead and bring it to your back just to make sure it doesn't fall over. It's a good way to hold yourself accountable while you're doing these exercises. So the bird dog is opposite arm and opposite leg. So let's just start with the arm first. We're gonna reach left arm overhead. Let me back up. Left arm overhead and drop it. So you're going just the left arm and drop it. And then we'll try and do just the right leg. So we're trying not to let that block move. And if you ever need to take breaks, take breaks. Again, if you're ever feeling pelvic pressure, pain, or feeling like you're gonna pee your pants, scale it back with your exercise. And now we can try and do both the arm and leg together, still trying not to let the block move. So get your toe and arm ready. We're gonna exhale, lift. Inhale, you bring your knee and hand all the way towards each other. Exhale, lift. Inhale down, and you might need to take breaks in between reps, and we're still focusing on connecting the breath with the pelvic floor. So as we inhale, everything expands. As we exhale, pelvic floor core engage. As we lift. Inhale, breathe into your back. Exhale. Core and pelvic floor turn on. Trying to keep a slight bend in your elbow. Maybe you're on your forearms. If it bothers your hand, so you can do the same thing here on the forearm. Trying to keep your gaze down towards your hands so the crown of your head is reaching straight forward. Exhaling up. Inhaling center. You can do a few more reps here and then we'll switch sides. And come on down. If you are on your wrists, you can shake out your wrists. And we'll do it on the other side. So we'll reset. You can bring the block back to your back if you were using it. This time weight is in our left hand. And left toe will come back, right hand will come forward. First you can start with just the arm lift and lower. So inhale, prepare. Breathe through your back. Exhale, pelvic floor and core. Lift the arm, crown of the head's reaching forward, gaze is down towards the floor. Inhale, lower. Exhale, lift. And then we can try and add the foot. Again, inhale, prepare. Breathe in through your rib cage. Exhale. Try not to let the block drop. And when you're ready, you can try to do both at the same time. Inhale, prepare. Exhale, gauge pelvic floor core. And down. Now, postpartum, we can lose a connection with our core, so that's why I am cueing the pelvic floor engagement, but ideally that should become subconscious. So we shouldn't have to always think about engaging our pelvic floor before we do activities, but it can be helpful to do pretty near after birth, just to help turn those muscles back on and reteach them to turn on when they need to. We'll do two more here. Inhale, prepare. Exhale, lift. And last one. And come on down, shake out your wrists if you need to. And before we go on to the next one, I just want to share what I think is a great, just general postpartum return to exercise. So, first week postpartum really shouldn't be doing much, should be in bed, laying down as much as possible. I like to say try not to be up on your feet for more than 5 minutes at a time, just remembering that you still have a huge wound on your uterus. So even though you can't see it and you might feel great, your body still really needs to heal, and we really just want to prevent higher stages of prolapse or discomfort. So even in the shower, setting a timer for 5 minutes, shower, get up, lay back down. Second week, more up on your feet for more like 10 minutes at a time. And that's when you can start to do more gentle exercises, like on your back, something like a bent knee fall out, knee side to side, gentle core work, marches. And then by the third week, you can start doing kind of exercises we're doing now, the bird dogs, the glute bridges, some side plank-like stuff. And then by 6 weeks is typically we wait until we add any resistance. So not doing any real lifting up until 6 weeks. And then typically not trying to return back to any high impact activity until 3 to 6 months postpartum. But of course, everyone's individualized, and some people can go back earlier, sometimes it takes longer. So working with a provider to help guide you through that process. And yeah, if you have any questions on that, feel free to type them in the chat too, but we're gonna go on to exercise number 3, which is gonna be a version of a side plank. So this is another sling system exercise. This is the anterior oblique and lateral sling system. So I'll explain those here. So we can either be up on our hand or we can come down on the forearm if it bothers your wrist. So for this one, we're engaging the inner thigh of the top leg. So I'll back up a little bit. So we're pushing that back foot down into the floor to engage the inner thigh, and then we're engaging through our obliques by rotating. So we're gonna exhale, lift up to the ceiling, inhale, breathe into your back. So this is the anterior oblique system. It engages the obliques and the opposite side inner thigh to help with a fascial sling system across the front. So inhale, round over into your back. Exhale, reach up. Inhale over down into your back. And we always want to keep our core gently drawn up and in with exercise. So if you ever feel like your belly's pushing or bulging out, take a break, wait for your body to reset, and then come back. So we inhale around through our back. Exhale up towards the ceiling. This also engages the lateral sling system, which is the glute, the outside glutes of the bottom leg, and the inner thigh of the top leg. So opposite side glute and inner thigh for that lateral sling system. Inhale, round over. Exhale up. Taking breaks as you need, and we'll switch over to the other side. So again, these sling systems help stabilize the pelvis, especially when our ligaments are more loose or lax during lactation. All right, catch your breath. You can always be up on your hand, or you can be down on your forearm, making sure you're not letting your ear come to your shoulder or your shoulder come to your ear this way. We're pressing our forearm down to the floor, keep a lot of space between your shoulder and your ear. We'll press up, we're trying to get in one straight line, so your booty might be backwards, so you need to tuck your hips forward. Bring your hand overhead. Remember this top leg, inner thigh is on, pressing down into the floor to engage the inner thigh for the sling system. So inhale, round over, gaze towards the floor, inhale into your back. Exhale, gaze up towards the ceiling. Inhale, round over, and exhale, lift. So that anterior oblique sling system is the inner thigh on the top leg and the obliques on the opposite side. That lateral sling system is the outside glutes on the bottom leg, inner thigh on the top leg, opposite side. Inhale, lower. Exhale, lift. We'll do 2 more. Again, taking breaks as you need, listening to your body. And then slowly coming down onto your hip, pushing yourself up. If you were on your wrist, shaking those out. And then we're gonna do 1 more exercise here. And I'm just gonna check to see if we have any more questions in here. Feel free to get some water, type any questions if you have any. Yes, someone says, why is there so much back pain post-birth? Now that can just be from muscle tension or trigger points, what you would cause. Also, these pelvic floor muscles can become really shot postpartum, and the pelvic floor muscles stretch double their length during childbirth. So sometimes they just kind of turn off and we have to train them to turn back on. These muscles are super important in stabilizing the spine. So the muscle is attached from the pubic bone to the tailbone and between both sit bones. And of course they have fascial attachments to the back as well. So sometimes low back pain, especially if it's instability related, can just be not having that deep core strength. Sometimes our more superficial muscles like our hip flexors, our piriformis, those deep external rotators, overcompensate for the deep core muscles. So a lot of times postpartum we have to retrain the deep core and train the other muscles that shouldn't be on all the time to stay off when we don't need them as well. So that's the reason why low back pain can be so common. Also that SI joint pain, if the pain's more, typically with SI joint pain you can point to it, you'll be like, yeah, I hurt right here. A lot of times that's from that ligament instability, which can last up to 6 months post stopping breastfeeding as well. And let's see what else. Someone says, I heard many good things about breastfeeding. I've heard you don't get a period, but you lose weight and etc. Which some people do lose weight with breastfeeding. Some people can't lose weight until after they stop. So it's really a hit or miss with that. But I mean, yeah, breastfeeding, highly recommend. It's the only thing your baby needs the first 6 months of life. And is it ever too late to start the exercises? No, it's never too late to start exercises. Once postpartum, always postpartum. So yeah, sometimes I see moms years and years and years postpartum, or even moms that are now grandmas that now their daughters are going through pelvic PT because of the symptoms I mentioned earlier, and they're like, oh, I didn't know that could be treated. So yeah, so many of these issues are common but not normal, and we can definitely help improve and even eliminate them. Yeah, 13 months postpartum and the scar still itches. That's when those desensitization exercises can help in that scar tissue mobilization. How do you do the exercise after C-section? So just with C-section, it does take longer to recover just because there's so many layers that were cut through, and the abdomen really does take longer to heal. But it does help to have some compression typically on the scar. Of course, check with your provider first, just to help kind of engage the core and help, like that belly band or those pelvic floor support garments. And then just, you might have to take it slower at the beginning, really focusing on that breath, finding that deep core strength as you exhale as well. And of course, if your OB or provider is telling you not to get back to exercise yet, of course, listen to what they say first. Sometimes post C-section, if you're cleared to start doing some gentle stretches, it can help to kind of do little back bends over a physio ball, or just hold like a cobra yoga position as well. And yes, it's always best to wait to get cleared from your OB. Highly recommend listening to that. But we will go ahead and get into our last exercise, and you can continue to write any questions you have in the comments. This last exercise, we need the yoga block again. So we're gonna be on our knees here. This one is a little bit more advanced, so if you wanna just lay on your back and do some of those marches like this, you can, or that knee fallouts to the sides, making sure your pelvis isn't rocking. You could do those instead. Otherwise, we'll grab our block. If you don't have a block, you can use your water bottle, really anything you can hold between your hands. Our arms are relatively straight. You can either tuck your toes under like this, or you can keep your feet flat, whatever feels better. This one is a great exercise for posture. So a lot of times postpartum, we're still stuck in that anterior pelvic tilt with our ribs flared open, kind of this way. So this one helps train our body to re-stack our ribs over our pelvis and get out of that anterior tilt. With the anterior tilt, a lot of moms will squeeze their butt muscles to try and tuck their butt under. What I want us to do is try and use our deep abdominal muscles. So we're kind of thinking like a magnet between our hips and ribs, and we're drawing those 2 points together. So squeezing into this block helps turn on those deep core muscles. So we're gonna start at the bottom. We're gonna inhale, expand the belly and ribs, exhale, squeeze in the blocks, and come on up, stacking up tall. So we'll inhale lower, breathe into your ribs, exhale, squeeze the block, and lift up. And if you have a mirror in front of you, we're trying not to arch back. We're trying to keep our ribs stacked over our hips. So it's shoulders, ribs, hips, all in one line. Inhale, prepare, exhale, squeeze, and lift up. And again, taking breaks as you need. So we're working the core and the glutes here, extending the hips. And again, that magnet, where instead of squeezing the butt at the top, try to keep the butt loose and engage the core to draw the hip towards the rib cage. The glutes are going to work no matter what because we're extending the hips, so you don't have to think about that squeeze at the top. Inhale, lower. Exhale, lift. And we'll do a couple more. Inhale, lower. Exhale, up tall. And come on down and shake that one out. So those are the 4 exercises I had planned for us to do that really don't need much equipment, can do at home. Again, I would wait until closer to 3 or 4 weeks postpartum, or especially until you're cleared by your OB before starting any of those exercises. But those are some good ways just to help get your muscles firing again, re-coordinating your breath with your core. So again, as we inhale, everything expands, everything relaxes. As we exhale, pelvic floor core engage. Again, that should happen subconsciously. We shouldn't have to think about it when we're doing exercise, but sometimes postpartum, the muscles lose that mind-body connection and we have to retrain that reflex, which is called the knack reflex. So that knack reflex is when pelvic floor turns on when we need it to subconsciously. So yeah, early postpartum, it can help to think about doing that pelvic brace. So that pelvic floor, deep core, zippering up towards your belly button before doing activities. And then it should become automatic and you shouldn't have to think about doing it anymore. Let's see, any more questions in the comments here? And then I do have a big announcement to make as well. Oh, someone says this is strangely very relaxing. Well, I think really a lot of people are never taught how to breathe correctly. So learning how to coordinate your breath with your core work is super important. Oh yeah, someone says my 3-year-old is on my back saying, yeehaw, that will make that exercise much harder. That's funny. And we'll have to check if there's gonna be a recording of this. I'm not sure. Maybe Laliana can message in the chat saying if that will be posted. And the plank exercise. Yeah, that plank exercise, I would wait a little longer on that one. And for the ones on hands and knees, I would wait maybe closer to 6 weeks for those two, just because those ones are a little bit harder to do. And can this be done every day? Yeah, these exercises can be done whenever. Yeah, every day is fine. With core work, you really don't have to, I mean, I know when you're working your upper body heavy or your legs heavy, they tell you to wait 48 hours, but with core work, you can do core work every day. And typically like 3 sets of 8 reps or working up to some, maybe you won't be able to do that much at the beginning, but slowly working yourself up. Someone says, would this apply to me as well if my baby was born 12 weeks early, so I didn't really get that big? Yeah, I mean, you carried your baby for the majority of the pregnancy, and yeah, the body still can have all these conditions pop up. Someone says they had really bad sciatica and have a lot of symptoms. It's hard to get off the floor. So sometimes with sciatica, those deep external rotators are really tight back here. I mean, during pregnancy, we get into this externally rotated state. So our hips are turned out, these muscles in the back get super tight, our glutes turn off. A lot of times people say they have that mommed butt. That's because those deep external rotators turn off. So a lot of times, releasing the pelvic floor muscles, releasing these external, deep external rotators and getting them in a better tone, and then retraining your glutes to fire instead of these deep external rotators can really help with sciatica as well. So I would definitely reach out to a physical therapist for sciaticas because we can definitely help with that as well. Let's see. What is the safest amount of reps to do in a week and for how long? So yeah, like 3 sets of 8 to 12 reps is typically what is just typical. But of course, listen to your body. Like I said before, we never want the belly to be bulging or pushing outward. So during the exercises, like say if you're on your hands and knees and you're doing the bird dog, you can bring your hand to your belly. If you don't feel like your belly's pooching and pushing out towards the floor, that means take a break, reset, until you can engage your core again. You might only be able to do 1 or 2 reps at the beginning, and just taking breaks until you feel reset. Let's see what else. And for how, so three sets of, if you have to start with just 2 reps, move up to 12 reps for all of them is pretty good. And you can do daily with core work, so you don't have to worry about that. Why isn't postpartum rage talked about, only postpartum depression? I mean, yeah, that's definitely a thing. I feel, yeah, but I would definitely reach out to, I know the Mom Cozy group has so much support, and yeah, finding moms to connect with about that. But yeah, I agree that they should both be talked about. My C-section has reopened twice to help not happen again. I would definitely make sure that you're following any precautions your doctor gave you, but again, sometimes wearing those silicone scar strips can help if you're cleared by your OB, or having some compression, so wearing a belly band or wearing those support briefs might help as well. And then learning how to engage your deep core. So sometimes with the pressure management, if our deep core isn't engaging and we're just letting all the pressure come out from our abdomen, that can make it more likely to tear. So really reconnecting with your core. Working with the pelvic PT can help as well. I know with C-section, your pelvic floor is still affected from the duration of pregnancy. So I always recommend everyone get a 6-week checkup with a pelvic floor PT. Someone says, my son is going to be 8 months tomorrow. This was the first month my period came back. Is this normal? Yeah, I mean, sometimes people don't get their periods back for up to 2 years or more, so it's really individualized for everyone, and especially with breastfeeding, that can delay your period coming back. Oh yeah, someone says, I didn't know this was a thing until my second baby. I know pelvic PT has really been on the rise, and in other countries like France, it's standard of care postpartum. So that's the goal, to have more moms know that they don't have to deal with these issues. And, well, before I read through the rest of these and answer, I do just want to make sure before any of you might hop off that Mom Cozy is having a postpartum recovery challenge. So the challenge is to post your new postpartum workout routine. So it could just be a quick video. You can post it on Facebook, on this group, and on Instagram. We ask that you do the hashtag MomFitness, MOM Fitness, and then tag Mom Cozy, and you have a chance to win $300 plus a Mom Cozy gift box. So I will go ahead and post my video next week, and in my video, so today these were more exercises for like 4 to 6 weeks or more, like earlier postpartum period, but then during my video that I'll make for this challenge, I'm going to do more exercises later on postpartum for moms wanting to get back to impact activities like jumping or running or things like that. If you need exercise ideas for this challenge, I do have a lot of exercise playlists with ideas on my YouTube, which is at Pelvis Restored, that I linked in a comment at the beginning of this chat. If you need some ideas for your video, as well as my Instagram, Dr.Krista_Pelvis Restored, for some ideas as well. And I will be checking in on this Facebook group to see all of the exercise videos you guys post. So again, that's Postpartum Recovery Workout Fitness Challenge, using the hashtag MomFitness and tagging at Mom Cozy for $300 plus a Mom Cozy gift box as the prize winner for that one. And again, I'll be posting more higher level exercises that can be done more later in postpartum for those of you who are later on and are wanting to get more back to impact activities like jumping or running or lifting and things like that as well. And let's just see what other questions we have in here. And the group here in the Mom Cozy Facebook group is amazing. There are so many other moms going through the same period of life, so I highly recommend reaching out, connecting with fellow moms. Let's see, getting up. It So this person says, I had my second C-section in November. For personally me, getting up ASAP definitely helped me. I felt like I was in bed for so long after emergency C-section, but definitely didn't get up fast the first time. Which, yeah, we don't want to be bedridden for too long because we don't want our muscles to deteriorate, but that's why going into pregnancy or being strong in pregnancy is so helpful postpartum, so that we have the reserves when we do have to rest so much postpartum. Let's see, water break, yes, take water. Let's see, anything else? And I'll go over those exercises one more time just in case any of you wanted to take down any notes. Oh yes, and Postpartum Support International is a great organization for any of you looking for more support, and they are going to be hosting a webinar on the 14th with Mom Cozy. Yep, someone says, I did pelvic floor in my pregnancy and my delivery was amazing. I always recommend pelvic PT during pregnancy as well. We could do a whole talk on just pelvic PT during pregnancy. Let's see, and I'll go ahead and Laliana shared in the chat the hashtag MomFitness and tag MomCozy, automatically enter to win $300 plus the gift box. And you can share it anywhere. So that's Instagram, Facebook group. The more, the merrier. We want to encourage moms worldwide to join this challenge. So post it everywhere if you can. All right, we're gonna go through all those exercises just one more time if any of you wanted to do little notes, or if you just want to get in another rep of all the exercises. So the first ones are the sling system exercises. So this first one was our bridge. We're working the opposite side lat and glute max. So we'll do left lat, right glute max. You can do both feet at the same time if that feels better. Rolling up one vertebrae at a time, pressing your elbows to the floor, slowly lower down. If you're feeling like you have the strength to do one leg, left arm, right glute. One vertebrae at a time up, one vertebrae at a time down. All the way up and all the way down, and I'll show the other side. So opposite lat, so right elbow to the floor, left glutes engaging. That's that posterior oblique sling system. From the lat to the opposite glute, that crosses the SI joint, helps with any instability there. All right, moving on to our second exercise, which was the bird dog. This is the longitudinal or deep sling system. So you can bring the yoga walk to your back. We're doing opposite arm as leg. So right leg, left arm. You inhale, prepare. Exhale, lift. You can always come onto your fist if that feels better. Inhale, prepare. Exhale, and lift. I'll do one more and switch sides. All right, opposite side, right arm forward, left arm back. Inhale, prepare. Exhale, lift. Getting that block up on your back. Inhale, lower. Exhale, lift. Again, belly's always drawing up and in. If you feel like it's starting to pooch down towards the floor, take a break. And one more rep here. We'll move into the third exercise. Coming on down. This one was the side plank, which, it's probably one of the hardest ones. So listen to your body. I'll be on my forearm. This one, we're working the anterior oblique and lateral sling systems. So bring your hips forward. We want to be in one long line. Right foot is on top, pressing down into the floor. We lift up into that plank, engage from underneath, shoulders away from ears. We inhale as we round forward into our back, and we exhale, gaze towards the ceiling. Keep that right foot pressing down into the floor. Inhale, lower. Exhale, lift. So that anterior oblique sling system was the obliques and the opposite side inner thigh, pressing down. Lateral sling system, opposite side glutes as inner thigh. So we get 2 in 1 with this exercise. Inhale, lower. Exhale, lift. Slowly come down, and we'll switch sides. Onto the forearm. Again, bring your hips pelvic alignment, helping us get out of that anterior tilt and rib flare. So ribs come down. Again, we're not squeezing the butt to bring the hips back. We're engaging the deep core from the front, booty stays loose. So grab onto your block or your water bottle. So you can be up on your toes, or you can tuck your toes down, whatever feels better. Arms are straight. Inhale, again, ribs expand. Exhale, zipper, pubic bone to belly button. Again, not squeezing the butt at the top. We're engaging the core for that slight posterior tilt to get out of the anterior tilt. Inhale, lower. Squeeze the block, ribs come down. Exhale, lift tall. And we'll do a few more. And rest. And whenever you're doing core work, or really any exercise can really become a core exercise, because you need core stability to reach for things, to squat and pick up laundry, really to do anything. So even with like a dumbbell curl, inhale, prepare, exhale, deep core, zipper. Before you lift, slowly let everything relax. And if you do have more pelvic floor tension, if your pelvic floor is not able to drop all the way down, or a lot of people when they engage, it takes a while for their muscles to come down because we get stuck, especially if you had a traumatic birth experience or just hold more tension in your pelvis, just like you can hold tension in your shoulders. Sometimes we can have trouble dropping all the way, so you might have to slow down your reps. Say you're in a workout class, you might only be able to do every other rep, so that way you can fully relax in between each rep. Also, just before starting an exercise series, working on that diaphragmatic breathing is great. Bringing your hands to your ribs, or hand to your belly, just feeling everything expand and relax, and come back down. So again, on that inhale, you're blowing up like a balloon. So belly comes out, ribs come out, pelvic floor should drop. Fill with air and lower and relax. As we exhale, don't do anything special, just let it come back. So taking at least 10 diaphragmatic breaths before starting your exercise series, and then at the end, another 10 diaphragmatic breaths. A lot of people can figure out the belly breathing pretty easy, but it's hard to figure out that rib cage and posterior rib cage breathing. So that's why I love doing on hands and knees. Even if you just kind of hold a cat position, you can focus on that inhaling into your back. Because sometimes when we don't get that big inhale into our back, that means more pressure is going out other areas. So if we're kind of stuck in this rib flare position, we're not able to breathe through our back, that's so much more pressure going out your belly, contributing to the diastasis, and down your pelvic floor, contributing to prolapse. For that ideal pressure management, we want ribs to be stacked over pelvis and be able to breathe into our back as well. So even if you're just at a counter, say you're making your coffee in the morning, you can go into a little plank at your counter. Inhale, round your back, exhale, squeeze. Just finding that scapular mobility and being able to inhale through your posterior rib cage can be really helpful for pressure management as well. And then just throughout the day, checking, making sure that you're not flaring your ribs open and finding that stack as well. Which, I mean, a lot of people say next posture is the best posture. So it's always great to be changing your posture throughout the day. It's not good to sit all day, it's not good to stand all day. But for pressure management, especially with workouts and lifting mechanics and lifting your baby, trying to find that pelvic stack, which this exercise really helps with. And you can get into a mirror and really find your stack here. So we're trying to get out of this position, hips in, ribs down. A lot of times we get to that rib flare here. So finding that nice posture. But I'll check in here to see if anyone else had any other questions. Yeah, and someone said this is difficult not to squeeze the butt in, and that's because so many of us postpartum have weak glute max, so those external rotators are taking over. You might notice throughout the day that you're just clenching your butt whenever you're doing activities that require deep core strength, and typically that's because your deep core is weak right now and you need to gain that strength. So try not to rely on squeezing your glutes, and maybe that's when wearing a postpartum belly band or wearing a support garment can help as a little crutch in the beginning until you gain back that deep core strength and you don't feel like you have to squeeze your glutes together to have stability. Let's see, anything else? And again, I have so many exercise ideas on my Instagram or on my YouTube channel, so if you need ideas for your posts that you're making, go ahead and check those out. And I will be checking in on Instagram and on this Facebook group to check in on your exercises, and if you have any questions while doing them, feel free to tag me and let me know. And I'm just scrolling through here. But yeah, that looks like everyone. If anyone else has any other questions, I am here at the chat looking. But yeah, someone says, so excited to add these to my morning routine. Love to hear that. Yeah, it's great to get into a routine. When you do the same thing every day, your body just knows, okay, time to do this, and we stay in the habit, right? We are so used to arching, and after having a baby, we have to unlearn that arch. That's so true. I mean, especially people who are gymnasts or who are always in this kind of flared open position, and maybe we've got our posture back before we get pregnant, but then during pregnancy, we just kind of get forced back into that posture, and it's so much harder to control. And yeah, my Instagram is at dr.krista_pelvis restored, which I tagged in the very beginning, the very first comment on this thread. And there's a link to that. And then my YouTube channel is at pelvis, pelvis restored, pelvis restored. And yes, do not overwork your body. Listen to your body. Remember, the 4th trimester is real, and it takes a long time for your body to fully recover from birth. So take it easy, drink water, take breaks, and remember that you might not think you're doing a lot of exercise, but just lifting your baby, reaching for a laundry bin, all these household tasks are all exercises, and they're all chances that you can take to engage your deep core and pelvic floor and retrain that stability through your deep core muscles. All right, well, I'll stay here for another 5 minutes to see if anyone has any questions. Otherwise, thank you so much for joining, and I'm just gonna repeat this postpartum challenge again. So it's the Mom Cozy Postpartum Fitness Challenge. You just have to post a short video of whatever workout you feel like is helping you through this recovery to help inspire moms around the world using the hashtag #MomFitness and tagging at MomCozy. And you have a chance to win $300 plus a Mom Cozy gift box. So not only are you spreading the joy of getting your body back postpartum, but also have a chance to win some awesome prizes. And let's see. Yeah, someone says, moving is something. You mamas got this. Never down yourself. You're doing amazing. Love that. Well, thank you so much for joining. Again, yeah, hashtag MomFitness. I will post my video on my Instagram at drkrista_pelvis restored, and my video will be more higher level exercises for moms later postpartum wanting to get back to more impact activities without symptoms like leakage and pelvic pressure. So yeah, and again, just to note, yeah, these conditions like diastasis, prolapse or pelvic pressure, urinary, bowel or gas incontinence, C-section or perineal scar pain or discomfort or restrictions, the low back pain, SI joint pain, or pubic symphysis pain, painful intercourse. These are all very common postpartum, but they are not normal, and pelvic floor and women's health physical therapists are available to help you improve and even diminish or get rid of these issues. So don't feel, I know it can be kind of scary to reach out to a pelvic health provider, or you're not really sure what's going to happen, but just know that we are here, and we do love helping moms get back to the activities they want to get back to postpartum. So, and then if you ever have any other questions for me, feel free to tag me on a comment on Instagram or on this Facebook group, and I'll try to answer you guys. And I do not see any other questions, but still, if you have any, let me know. I'll stay, let's say, thanks so much. Thanks to Mom Cozy for getting us together. Yeah, so fun. I'll stay on a few more minutes if anyone has any other questions or things they want me to go over, or even if it's just you want to know more about a specific topic like diastasis or prolapse or incontinence, C-section, perineal scar pain or restrictions, back pain, SI joint pain, pelvic pain. Someone says, I just found out I am pregnant and I'm currently pumping. Is there a way to get my supply back up? I'm not a lactation consultant, so I would definitely consult with one of them. That's not in my scope, but. Yeah, and I know postpartum, it can be so easy to forget about taking care of yourself because you have your newborn to take care of and all things around the house to take care of, but remember that your self-care is the most important. You can't take care of anyone else well if you don't take care of yourself, so your recovery is very important. Again, if you have any questions or things you want me to go over real quick here at the end, feel free to comment. C-section scar pain, how do we deal with it 9 months postpartum? Well, my questions would be, were you able to mobilize your scar, or have you tried mobilizing that scar tissue? Sometimes, dry needling or acupuncture, sometimes a trained physical therapist or acupuncturist can do dry needling, which is basically acupuncture needles into the scar tissue to help make it less restrictive. Also, there's things like cupping that you can do over the scar, or just the scar tissue mobilization. You can reach out to a pelvic health provider to help with. And sometimes it can just be restrictions from the C-section scar that can be affecting the mobility of the bladder or the uterus or the bowels and contributing to pain. So I would definitely reach out to a pelvic health provider to help with any C-section scar pain that you're still having months down the road. She goes, hello, I got on here late. I've been told it's normal to have pelvic pain, and I am only 3 months second pregnancy, but I definitely feel worse this time. I've done stretches, but it doesn't really help with a toddler. So sometimes with the pelvic pain during pregnancy, these are the pelvic floor muscles in red. Sometimes during pregnancy, our body just loses that mind-body connection. Ideally, our muscles, pelvic floor, should just turn on subconsciously during impact or like lifting, reaching, any kind of activity. So sometimes during pregnancy or postpartum, we can lose that connection and we have to relearn how to engage these deep core muscles properly. So that's that Kegel or pelvic floor contraction. So sometimes it can be that, sometimes it can be from the ligament laxity. So the exercises we went over today were exercises to help with some of the sling systems in the body to help provide some more support to these joints that can get more loose or shear past each other. Sometimes we don't have that pelvic floor strength, we don't have that support to the pelvis as well, that can contribute to pain. So those are some things that might help. And yeah, sometimes with that, things like stretches aren't really going to help because it's more the muscles need to relearn how to fire when they need to. This says, are you recommending this exercises during watching TV or doing something else, or just focus in the moment? I mean, especially in the beginning, it can be really helpful to just be focusing on the exercises because it is a lot to think about, especially coordinating the breath with the core engagement. But once you feel like you've got all that down, I don't see why you can't multitask. I mean, who has time to not ever multitask, right? And then my C-section scar hurts for weather changes. Is this normal? Will it change? I hadn't heard that one before. But I mean, other pains are associated with the water and pressure changes in the atmosphere and things. So But I would say it's never normal for your C-section scar to hurt, especially if you're past that like 12-week stage. So it might be restrictions in the abdomen or near the scar, or even just sometimes with the C-section scars, then our hip flexors can get tight, our diaphragm can get tight, our muscles that attach from our ribs to our hips. So sometimes getting those muscles back into their normal resting tone and then retraining the deep core to turn on when it needs to can help with pains around the C-section scar as well. And then I've also been having sciatic nerve pain. Any tips or tricks? So a lot of the times with that sciatic nerve pain, the deep external rotators, like the piriformis, which isn't shown here, but it comes across here, the sciatic nerve comes out through the piriformis here. So sometimes when these deep external rotators are tight, they can irritate the sciatic nerve. So that's one reason why I like to say don't squeeze your glutes or bottom at the top of exercises, because when we squeeze the glutes intentionally at the top of the exercise, we're biasing ourselves into that external rotation, and that's turning on these deep external rotators. So sometimes thinking about engaging your inner thighs, when we engage our inner thighs, that helps us come into internal rotation, and that way we can open our sit bones and have less tension from those deep external rotators, or even doing some stretches where you're stretching out those deep external rotators. So here, I'm engaging my inner thigh on my bent leg. I'm bringing my pocket, my back pocket on my pants, towards the camera here. So I'm stretching out through those muscles. So sometimes working on that mobility and stretching through those muscles can help. You can also get like a little ball, a cross ball, and roll out those muscles on a wall or the floor as well. A lot of times with the sciatic pain is muscle tension around or fascial restrictions. Sometimes also the sacrum, especially postpartum, we can get stuck in a birthing pattern where the sacrum is kind of stuck, flexed forward, and the tailbone kind of comes backwards. So sometimes we need to bring the sacrum back into an ideal position for the pelvic floor muscles to be able to function optimally. So sometimes that can be contributing to the sciatic pain as well. Someone says, I want to start after 2 C-sections, one 5 years ago and one a year ago, but didn't even know how to start. You mean to start in core rehab, or I'm not of course, you can start with a pelvic therapist or really anyone, and there's no, you don't have to go just like 6 weeks postpartum. You can come years postpartum, so it's never too late to start pelvic PT, if that was your question. Let's see, anything else? Someone told me to squeeze the pelvic area or the genital parts especially is good to do in whatever moment. So it can be helpful, I'm assuming they mean the pelvic floor muscles. So especially postpartum or during pregnancy, it can be helpful to do that squeeze before doing really any movements that would impact your abdominal pressure. So whether that be before lifting something, pushing, pulling, coughing, laughing, sneezing, rolling out of bed. Pregnancy and postpartum, it can be helpful to do that pelvic, what I call the pelvic brace, which is when you're engaging the pelvic floor. So that's like you have a marble in the vagina, squeezing around the marble, pulling up towards your head, doing that zipper pubic bone to belly button, but then making sure you're fully able to relax afterwards. Sometimes people will have more pelvic pains just all the time if those muscles are tight and aren't able to fully relax. So a lot of the time, if the pain is with more reaching activities or lifting activities, that's probably more due to the ligament instability and the pelvic floor not turning on when it needs to. But if you're having pelvic pain or back pain that's more constant, it might be more likely to be tight muscles that need to be retrained to not turn on when they don't need to be. Let's see if there's anything else. This person says, I had a PT give me exercises, but always made me worse or didn't help at all. I'll definitely try and thank you. Okay, well, yeah, let me know. I'm not sure what they gave you, but hopefully you were able to not get worse. Oh yeah, someone says, I wish I saw this when I was pregnant. I could barely walk sometimes. Yeah, a lot of people don't know that pelvic PT is here during pregnancy, which I would say, yeah, I see a lot of people in pregnancy. I'm always trying to push more and more people to do it in pregnancy. If it was me personally and I had to pick one, I would probably still pick pregnancy, because there is so much we can do to help prevent tearing, to help prevent prolapse and diastasis during pregnancy, so that way we don't have as much to work on postpartum. And then someone says, can you fix hip pains when going to sleep? So a lot of times for moms I see that have hip pain at night, it can be really helpful to use a massage gun before going to bed. So just like 2 minutes or less per area, you can do the inner thighs, the front of the thighs, the glutes and the hamstrings, just to help get those muscles relaxed before you go to bed. I find really helpful for the night hip pain. And yeah, just to mention some stuff for during pregnancy. So the 3 main ways to prevent tearing are learning how to relax these muscles on command. So we should be able to squeeze when we need to, relax when we don't need to. A contracted muscle during labor is much more likely to tear than one that's relaxed. Also, finding which birthing positions that your pelvic floor is most able to do that bear down sensation. So when you're giving birth, it's kind of like a huge bowel movement. So we can practice that bearing down sensation in all of the different birthing positions and figure out which one works best for you. And then also the perineal prep, which is kind of like the trigger point release for the pelvic floor muscles, getting all these muscles soft and mobile, can really help. With the pelvic floor muscle, a tight pelvic floor muscle, if you bring your pinky and thumb together, that's kind of what a tight pelvic floor muscle feels like. And if you bring your index finger and thumb together, that's what it should feel like, soft and springy. So ideal muscle tone for a pelvic floor muscle is soft and springy, like if you bring your index and thumb. A tight pelvic floor muscle feels more like if you bring your pinky and thumb together. And let's see if there's anything else. And yeah, everyone is very individualized, but someone said, I wish there's more information out for this. A lot of times we go into pregnancy and postpartum not knowing a whole lot because it's so different for everyone. But yeah, there are women's health physical therapists that this is what we focus on. So there's definitely resources available, but yeah, we're still trying to spread the word so that more and more moms know about all the resources. Yep, and everyone's body is definitely different, but there are definitely still some patterns that we tend to see for mom's pregnancy and postpartum as well. All right, well, if I don't see any more questions in the next minute or so, I'm gonna tune off, but thank you so much for joining. And again, don't forget about the Mom Cozy Fitness Challenge. You have a chance to win $300 plus a Mom Cozy gift box for just posting a video of you doing any kind of postpartum recovery exercise on Instagram, on this Facebook group, really anywhere you want to post it. We're trying to encourage moms around the world to focus on their postpartum recovery. So please do that, and I will be on Instagram and in this Facebook group checking in on your exercises. And I don't see any other questions, so I am going to tune off. But again, thank you so much for joining, and I hope to chat with you guys again sometime soon. We'll see if I can figure out how to end this thing. All right, thank you so much. Bye.